Welcome to the Pelvis Party, a health talk show in partnership with Olmsted Medical Center, where experts and guests dive into real conversations about hormones, sexual and pelvic health, and everything in between. We're creating a space for honest, judgment free talk. There are no dumb questions, no awkward topics, and definitely no shame.
Hi, everybody. Welcome back to Pelvis Party. My name is Becky Mopetit. I am the owner of Rochester Local, and today I am joined by Tara Suffrins, nurse practitioner at Women's Health at Olmsted Medical Center, and Britt Marshall, marketing communications at Olmsted Medical Center. Tara is a nurse practitioner at Women's Health. What does that mean? Who do you see? How old are they? What are some things you treat?
So I see women primarily age 21 and older. We see annual physical exams. I talk to women about irregular menstrual bleeding. I see a lot of women for any really women's health concern, birth control, contraception, thinking about, planning for pregnancy, infertility concerns, anything. STD screening. I'm trying to think of everything.
And what we're here to talk about today, UTIs.
Urinary tract infections.
That's
Yay.
what I was going to say. Today we're talking about UTIs, everybody's favorite topic. So you get a little message that comes across your screen and it says, "Help me. I think I have a UTI."
Okay.
What is your first step when someone comes into the office? What are some of the questions that you might ask? Why would someone get a UTI? What is the difference between maybe a one-time or a reoccurring UTI?
Well, notoriously, someone calls on a Friday afternoon when they're leaving
Right.
for vacation.
Always.
And they have something going on for the last couple days.
Right. It's never like, I have 5 hours of open time.
Yes.
Hey, wait a minute. That was me last week. This really just happened last week. So,
And when I found out I was going to be on the Pelvis Party and talking about UTIs.
Wow. How convenient. True story, folks. Right?
It is.
Yeah.
It really is.
Yeah. Hey, maybe a misconception is that when you have a UTI, you're dirty down there.
Right.
No, absolutely not. So I always say, I guess being female is a risk factor for getting urinary tract infections just because of our normal anatomy.
Right.
And then sex. Hey, the two in combination are very common, and we get UTIs sometimes.
Right. And so I think, right, you talked about one of the misconceptions right now is that you get these because you are dirty or you have not been properly keeping yourself tidy or well cleaned or maintained.
I always say to women who feel that way or when they come into the office, guess what? I think most of us women by 21 have figured out hygiene. So
Right.
we
Right.
have figured
Probably
it
not
out.
it.
So that's not it.
Right. And how often do you meet with a friend or it goes like this? How are you feeling? I don't feel so good. What's going on? I have a. But we always whisper them. Why are we ashamed of talking about something that is so
It's inconvenient. It's unknown.
right?
And sometimes new.
It's so a part of our anatomy, but we've been ingrained and cultured to just talk about a UTI, which is so uncomfortable and so painful in kind of a shamed, whispered sort of fashion. I'm sorry. A UTI is something that we should all just be like laying in bed with our feet propped up about, right?
Mhm.
They
She
hurt.
says,
Yeah.
They hurt. They hurt. So a patient comes into your office, and how might you diagnose, treat this?
A
Walk
lot
us
of
through those
times,
steps.
probably 99% of the time, patients know that they have a urinary tract infection. They have burning with urination, increased urinary frequency. Sometimes they'll have a little bit of a malodorous urine and just not feeling well. You might have a low backache, have a little bit of a fever.
Yeah.
Just know something's not right.
Right.
Your bladder feels heavy.
Oh.
And it's not. And because you go to the bathroom and it's just trickle, trickle. So disappointing.
And I feel like
Right.
that's another thing, that urinary hesitancy. You feel like you got to go, but you can't go.
Right.
So pretty classic signs. We often just do a quick urine test. It's a simple test.
Right.
Um,
Can Can we talk about that?
Mhm.
So, when you have this frequent urinary urge, when you have a UTI, is it that your bladder is actually full and you cannot void? Or is it that your urethra is irritated and then it just feels like you have to go?
It feels. So we call urinary tract infection because it starts at the opening of the urethra. That's where
Okay.
that bacterial starts and it can track up to the bladder, but it doesn't mean the bladder's full and we can't go. It's irritation.
Hmm.
So yeah,
So, is it just your brain telling you, hey, something's wrong down there and we don't really know how to fix it? So, let's just try going to the bathroom to see if that's what's going to fix it? Okay, okay. So the are there any other so we hear a lot of times about just drink tons of water and it'll
mhm,
go away. People will oftentimes not want to make an appointment to come in and see the doctor. It's inconvenient. They don't want to. It's
expensive.
expensive. They don't want to
Mhm.
pay for it. They can't find the time in their calendar. Kids have 1 zillion activities, so they will treat at home.
Yep.
They'll take tons of cranberry. They'll take
Mhm.
cranberry extract. They will drink tons of water.
Mhm.
And sometimes ward it off.
Yes. What do you have to say about that?
So I feel like they're all good things. Of course, we naturally are trying to push fluids to flush it out and get rid of it.
Mhm.
And there is proof to show that cranberry tablets and cranberry juice, but cranberry is kind of an antibacterial static
Mhm.
and it can help kind of flush. It will not treat a urinary tract infection if you have one.
Okay.
That's kind of full blown. It may help it and prevent it, but you still may end up in the
Okay.
office.
So, what would happen then if a urinary tract infection went untreated?
Most of the time, it's not going to. Sometimes, if you get better, then it took care of itself.
Okay.
And otherwise, you'll be in the clinic. We worry about moving up to the kidneys.
Uh-huh.
So, a kidney infection, but that's not that common.
Okay.
Most people are just so uncomfortable, they eventually make themselves come in.
Okay. Yeah. I would yeah, cuz you get uncomfy.
Yes,
And when they move to the kidneys, that's a that's a
they're
pain.
sick. People are very sick.
Right.
They
That's
don't
a
feel good.
pain unlike any other. So, what happens when okay, so a one-off. You have a one-off urinary tract infection, UTI. Get an antibiotic or you flush it out yourself. Take cranberry extract. What happens when they reoccur? What happens when you keep getting them?
Okay. Well, people can just get one just because maybe they
Mhm.
recently became sexually active or they
Mhm.
hadn't been and now they are, or with hormone change, sometimes we notice that. But we start talking about prevention. So, how can we prevent it? So, starting a daily cranberry tablet, continuing to push fluids, making sure you void after intercourse,
Mhm.
and trying to identify what the trigger is for you.
Mhm. What are some of the other risk factors that might be associated with reoccurring um, UTIs?
Feel like if when we talk about reoccurring, does the urinary tract infection actually get treated? So sometimes we think we treated it and the symptoms are persistent. So we just have to try a new antibiotic. So it's sometimes very simple. But I guess where say that again as far as
I was just
risk factors, really honestly, female,
yeah.
being female and
Really depends on when they're
yeah,
occurring. Like, so
Yeah.
what I really appreciate about
yeah.
Tara is I had 6 this year so far,
Oh,
which is just,
you
awful.
poor
So I just
thing.
thought it was coming back or it never got nipped in the butt,
Mhm.
for lack of better words. And so Tara and I, we talked about, okay, when is it happening? What are the symptoms? And we figured out it was post-coital or after sexy time.
Mhm.
And so now we have a plan in place and we
Mhm.
came up with that plan together and it's working so far. So,
Mhm.
um,
So for recurrent UTIs, then a
yeah.
couple different ways of treating are really just thinking, can we make some small lifestyle modifications
Sure.
to prevent them, and or can we try something like if it is happening after intercourse, then
Mhm.
sometimes we'll do a one-time antibiotic following intercourse,
Mhm.
and
Okay.
that can prevent it. And so we give a little supply of antibiotics,
Okay.
and someone takes one after intercourse, and that can help prevent them.
Uh-huh.
If someone continues to have them, then we start looking at like daily prevention, which is sometimes using a low dose antibiotic
Sure.
for anywhere for 3 to 6 months.
Okay.
Yeah.
Okay. Wow. So there's an abundance of ways to uh, address and diagnose and attack this problem, right? Which is what we're going to do. We're going
Yep.
to attack this. No one wants a reoccurring UTI.
Yep.
So are you prone to UTIs at certain ages? I think I hear a lot about when you start to get older, past menopause, maybe UTIs start to creep up a little bit more
Okay.
often. Is that true?
Yes and no. Some
Mhm.
people luck out and never have a UTI, and we can say, lucky.
Wow,
Yeah.
lucky.
Lucky.
Uh-huh.
But then I say, I guess young age and becoming sexually active, we see it, or we call it honeymoon phase for when somebody, becomes sexually active.
Yeah.
And then as we age, just the normal vaginal mucosa becomes less acidic and less protective,
Uh-huh.
and we can be a little bit more prone to urinary tract infections. Now, if somebody has an infection, a
Yeah.
vaginal infection like a yeast or a bacteriovaginosis, then that might set the stage for getting a urinary tract infection too.
Okay.
And the
So,
culture that you perform will tell you all like the pH and right. It
yeah.
tells you certain things about that you can look for indicators of
Mhm.
something that's a little bit more
Yep.
serious or
Yep.
Okay. Speaking of, I keep tests at home, AZO tests or AZO tests.
Yeah.
You can get them over the counter at Target or just on the shelf or whatever. Valid, invalid. I need to know.
And I guess, is it like a urine dip, just like they do at the lab? Tell me
Yeah,
more about it.
it's just something that's supposed to tell you like
Okay.
if the probability of
Okay.
you having a urinary tract infection. And then so sometimes you're like, "Ooh, do I, don't I? Do I, don't I?" And I don't want to go in
Yeah.
because I have gone in before and they're like,
Yep.
"You don't have
Oh,
one."
you don't have one. Okay. Hmm.
And it could be another irritation or something or whatnot.
Yes.
And I just don't.
So I always say if it's a urine dip test,
Yeah.
basically you're dipping a strip
Yeah.
into a urine and then you hold it up next to the
Yes.
bottle and it tells you the colors. We do the exact same test at the clinic.
Yeah.
So that's the beginning test.
Yeah.
And so if we see something that shows a little bit more presence of
Yeah.
bacteria or, the pH, and we check a few factors on it, and yes, there's a high probability. But what happens at
Yeah.
the office instead of at home is we look under a microscope.
Sure.
The lab person does. And we say, what is the presence of bacteria?
Okay.
So, and yeah,
Uh-huh.
so we get a little fancier. But
Uh-huh.
so I always think about what are ways to have women come in and have convenience and not break the bank.
Mm-hmm.
So we have a UTI protocol through our nursing triage line.
Uh-huh.
So if they want to come in, if they call and say, hey, I'm leaving for vacation or I have a big event and or work's too busy, I can't get off today. There is a simple questionnaire that they ask.
Yeah.
And if you're not a person who has had recurrent problems or other major problems, we will treat accordingly to protocol.
Oh,
So
you don't have to
someone,
come in.
yes,
also
So-
our fast care locations offer the dip test
Yes.
for I think it's $55
Uh-huh.
to be seen
Yeah.
at the fast care. I had to use that twice before I
Uh-huh.
finally came in to see Tara.
Yeah.
So very familiar.
So that's
Simple.
an option too.
Yep.
I
And if it is
always-
presenting, then they
Yeah.
will prescribe.
Okay, great.
Yeah. And I always say if it's my patient and they've been seen and they're regularly seen, I will try to make life convenient. Hey, by the way, can you give me that antibiotic you gave me last year for just in case? So I can put it in my purse, tuck it in my pocket, pull it out when I need it.
Yeah.
And then I say, yes, I'm more than willing to do
Yeah.
that. And so someone who has a little bit of tendency for maybe once a year or twice
Sure.
a year to have that convenience.
Mm-hmm. And my chart is a great way to communicate with your
Yep.
provider
Yep.
as well.
Yep.
That way too. So
Yep. So some easy tricks.
super helpful information about a super inconvenient, horrible issue. And I am very sorry to you. But it sounds like you've
We're
got
taking care
yourself
of,
sorted
yep.
out, right?
Yeah. But what do we say? Our motto, don't settle.
Do not
Do not suck it up.
settle. Absolutely do not settle. If you have the tingle, the very familiar tingle, don't settle. Do not sit there in agony for 10 days when you could sort yourself out in 2, right?
Right.
Yeah.
Exactly.
Okay. Tara, thank you so much for joining us on the Pelvis Party. Britt, it's always wonderful to see you. Thank you for joining us on the Pelvis Party. For more information, go to rochesterlocal.com/pelvis party.
Thanks for tuning in to the Pelvis Party. As we always say, there are no dumb questions, and this is a safe place to ask them. So please drop us a line, let us know what's on your mind for a future episode. And as always, like and follow for more.